So, Elinor, thank you for joining me today. We're going to be talking about the interoperability rules and information blocking rules that were recently published by HHS. I have a question for you. What was the overall intent behind the interoperability rules first, and what were some of the major requirements that came out of that rule for providers and payers?
So I think the intent with these rules is really related to the flow of information through the healthcare system, both from payers to patients and across providers. There was a sense that information was siloed in different electronic health record systems, and the intent of the rule is to allow for a freer access to that information. So there are a set of requirements for providers that are in the interoperability rule that came out of CMS. These are written into the hospital conditions of participation. The newly modified conditions of participation require hospitals to demonstrate that their electronic medical systems meet minimum requirements with respect to the communication with patients and the exchange of health information. Providers are encouraged to publish digital endpoint in a public database and allow easier access to patient information from health apps and electronic health records. Payers have additional requirements under these rules. So CMS regulated health plans are required to implement and maintain a patient access API. So to actually allow information to flow to apps or otherwise through a standard format that will let data sharing with both enrollees in those health plans and with the third-party apps to ingest that information that's currently held by a payer. And applicable payers also are required to make provider networks publicly available through a provider directory API. There's a sense that transparency requires a sense of a better access to information in terms of which providers are actually in networks, and they're trying to address that problem with the provider directory API. You also asked about the information blocking rule. So we talk about interoperability, information blocking. These are actually, as you know, two separate rules, one out of CMS and one out of ONC, or the National Coordinator for Health Information Technology. The information blocking prohibitions restrict regulated actors from preventing access to the exchange of, or use of electronic health information. So if you interfere with access, exchange, or use of electronic health information, then under the new rules, you could be violating the information blocking prohibitions. So those apply to payers and to health plans. They also apply to health information networks or health information exchanges, as those terms are defined in the new rules. So these actors have to be even more careful than they've been in the past to make sure that they're allowing access to information as appropriate.